Finally, coming to salivary gland. So salivary glands are 3 in number. The major ones are 3 in number, and there are numerous minor salivary glands situated, all around your oral cavity. But our concern now will be mostly on the major salivary glands. Okay, so the parotid, the sublingual, and the submandibular salivary glands. So we will be talking about the relation and the various structures which are related to these particular salivary glands. So first we are talking about sublingual salivary gland. Now in the picture, see the location of sublingual salivary gland. See the location of sublingual salivary gland. Someone's mic on. Noise. So have a look at this sublingual salivary gland. Understand first the location. Understand first the location. Where is it located? It is located somewhere very close to the duct of submandibular salivary gland, and basically in the floor of mouth. So when you raise your tongue and you can see the floor of mouth, and in there are multiple, or there are sublingual salivary glands with multiple ducts. So through multiple small ducts, it's going to give saliva in the floor of mouth. So it is smallest of the 3 salivary glands. So among the major salivary glands, the sublingual salivary gland is the smallest, situated above the mylohyoid and below the mucosa of floor of mouth. Many times they have asked this question, where is this situated? So it is above the mylohyoid muscle and below the mucosa of floor of mouth. So just below the mucosa, okay? Ducts of Rivinus. So all of you should understand that ducts of Rivinus is the name of ducts or name of sublingual salivary gland ducts. So have you heard of Bartholin's duct? Anyone had heard of Bartholin's duct? Yes or no? Bartholin's, have you heard of it? Oh yeah, many of you have heard. Okay, yeah, it is the largest one. Now, what do you mean by largest one? See, ducts of Rivinus are 10 to 15, and it emerges from the sublingual gland. And among the ducts of Rivinus, you have something called as Bartholin's duct, which is largest of the sublingual duct. So it is one among the ducts of Rivinus. Only thing, this is the largest one. Okay. So now coming to submandibular gland. So now this is your submandibular gland. Now see the location of submandibular gland. See the location of submandibular gland. Now I am marking this structure. Can you name what is this structure which I am marking in yellow? What is this? Which nerve is this? Which nerve is this? Now I am marking another one in red. Which nerve is this? So red, what is red? Red is what? Red is IANB, inferior alveolar nerve. It enters the mandibular foramen, isn't it? Now what is this yellow colored one? Yes, very good, lingual. Okay, so just see, the inferior alveolar should go inside the bone. The lingual is outside the bone, and there are few relationships of lingual. This is very close to the crown of third molar, then it comes down and it goes anteriorly and it loops around this particular duct of submandibular gland. So it loops around the submandibular gland's duct. We call it as Wharton's duct, and it supplies the tip of it reaches up to the tip of tongue. Okay, so important structure here is to another two nerves. So which are those another two nerves? Which is this nerve? And no, sorry, another two structures. One is a nerve and one is a muscle. Which is this muscle? Can you name the nerve and can you name the muscle? Yes, mylohyoid nerve and mylohyoid muscle. So before the inferior alveolar nerve enters the mandibular foramen, it gives out a small branch known as mylohyoid nerve, which is going to supply two muscles, that is mylohyoid muscle and anterior belly of digastric. Both anterior belly of digastric and mylohyoid muscles are derived from the first branchial arch. You remember that? You remember tensor tympani, tensor veli palatini, mylohyoid, muscles of mastication, and anterior belly of digastrics. Okay, TTMMA. That's how, yes, very good. That's how we had remembered it. Okay, so now come back to our, yeah. Now in context, you have the white arrow. In context, you have a gland which is being divided by this mylohyoid muscle. Okay, can you see the mylohyoid muscle is going to divide, or it is divided the gland. There is a small part here and there is some part which is going outside. This is some part which is going outside. So the gland is responsible for the division. I mean, the muscle is responsible for the division of the gland. So the muscle's name, which is involved in division of submandibular gland, is, when the question comes like that, which muscle is responsible for dividing submandibular gland into superficial and deep part? It is your mylohyoid. Okay, so let's move on and see what all things are there. Okay, it's a J-shaped gland divided into superficial and deep part by mylohyoid muscle. So how is it J-shaped? Now I'll just draw and show you how the picture of it will be. This will be a picture of mylohyoid. Sorry, a picture of your submandibular, and this will be a picture of mylohyoid muscle. So the gland is being divided by this particular muscle into deep part and superficial part. Okay, so when you look from above, it looks like a J. Just look from above, it looks like a J. The gland looks like a J. Okay, now duct, the Wharton's duct. Okay, the name of the duct is Wharton's duct, and a few of you will be remembering from your third year and final year. We always talk about this duct in relation to silolith. Why? The duct has very tortuous course. It's against the gravity. It opens upwards, and the secretions are predominantly mucus secretions, slow secretions. So that's why there is higher chances for a salivary gland stone or silolith to form. Okay. Now, in the relationship, the gland is in close relationship with facial artery. So, relationship of submandibular gland. Oh, there are lots of things here. So, what to do now? Now, let's locate the mylohyoid muscle. So, this is your mylohyoid muscle. So, now why did I locate mylohyoid muscle? It makes our study easy. Why? The mylohyoid divides the gland into deep part. This will be the deep part. Okay, this much will be the deep part, and another half will be your superficial part. So this much will be your superficial part. So the gland is being divided into deep and superficial part. So now let's not worry about the deep part. So we will close this deep part here, and we will talk only about the superficial part. So what are the structures the superficial part of your submandibular gland is related to? So let's see. Firstly, you have a skin which is outside. Then you have the platysmal muscle just below the skin. Then you have the investing fascia. So pretty much common stuff. Nobody is going to ask you whether skin is lateral to this thing or skin is superficial. Nobody is going to ask these three things. But they'll definitely ask you about certain other structures which are very close. One is your facial artery. Just see, it is more superficial and it's also entering, or it is looping around the mandible. It enters from the deep part and it comes out to the face through the, or from the angle of mandible. Okay, so it is in close relationship to the superficial part. Then mandibular branch of some nerve, which is this seventh nerve. Which is the seventh nerve? Facial nerve. Yes. Then you have lymph glands. So we call it as facial lymph glands. You have the facial lymph gland, which is very superficial, and you have the submandibular lymph glands, lymph nodes, which are very much close to the submandibular gland. So next is facial vein. And finally, you have something called a cervical branch of facial. So I'm going to round this entire structure, and all you need to study is, if you look at this, all you need to study is regarding facial nerve, facial artery, and facial vein. So everything related to facial. So you have a facial artery there, you have a facial vein there, you have the mandibular and cervical branch of facial nerve. So that makes your study very easy. You have to just remember about facial structure, facial artery, facial vein, and facial nerve, and lymph glands, most probably facial lymph glands. Okay. And what about the structures which are in the medial aspect of the superficial part? You have the mylohyoid muscle and the mylohyoid nerve vessels. This is mylohyoid nerve, this is mylohyoid vessels. Okay. So that is regarding relationship of submandibular gland. The deep structures, or the other relationship which we should know, is the relationship from the from the lateral aspect. When you view it from the lateral aspect, the surface is divided into three parts: the anterior part, the middle part, and posterior part. So you have an anterior part which is related to the, this will be the anterior part, which is related to the mylohyoid muscle, mylohyoid nerve, and vessels. Then you have a part which is known as the middle part. So you have the hyoglossus, styloglossus, lingual nerve, submandibular ganglion, all those things here. Okay. And then you have the posterior part. In posterior part, you have the styloglossus, stylohyoid ligament, and the ninth nerve and wall of pharynx. Okay. So this is another way of, asking questions, or another way of eliciting the relationship. So when you divide the medial surface into three parts, anterior part will be related to the mylohyoid, middle part will be related to the lingual nerve, submandibular ganglion, and hypoglossal nerve, hyoglossus muscle, and styloglossus muscle, and posterior part will be related to styloglossus, stylohyoid ligament, ninth nerve, and wall of pharynx. Okay. Now, important thing of today's discussion, this I'll finish parotid and come to this nerve supply. Okay, I just finished parotid and I'll come to this nerve supply, and then we will see the questions together. I think that's more better. Yeah. Now coming to parotid gland. So parotid gland, where is it situated? It is situated just in front of your ear, and it is a very large gland. And the duct goes anteriorly and it opens just near to the upper second molar, and it is known by the name Stenson's duct. So sometimes you might get an accessory parotid gland, and if it is present, it is usually present in the anterior aspect, mostly over the duct. Okay. So our important things, or important structures which we need to know is the structures within the parotid artery. So have a look at this. Within the parotid gland. Firstly, arteries. have a look at this. You have the external carotid artery, which is going to divide as posterior auricular, and then further it is going to terminate as maxillary artery and superficial temporal artery. It gives in branches maxillary artery and superficial temporal artery. So this division takes place within the parotid. What about the vein? When you come from above, you have the superficial temporal vein coming here, maxillary vein from side, which forms a retromandibular vein. It is going to divide into anterior and posterior division, and in anterior division, a facial vein is going to join and it forms the common facial vein. The posterior division joins with the posterior auricular vein to form the external jugular vein. These are the vein which is present. And finally, you have the 5 branches of facial nerve. Okay. So when I'm describing it, I would like you all to learn this particular diagram, picture which I'm going to draw for you. So first thing I'm going to draw is the gland. So this will be your duct and this will be your gland. Okay. And what about the vein, or what about the, we'll talk about the artery first. So firstly, we have the external carotid artery coming up. The external carotid artery coming up, a posterior auricular artery going backwards. This goes up and it divides into its terminal branches. Which are the terminal branches? The terminal branches are maxillary artery and superficial temporal artery. For time's sake, just learn the names. We will discuss in detail about this artery in coming base session. Okay. So you have the maxillary artery here. Then the superficial temporal artery goes up. Okay. So maxillary artery and superficial temporal artery. Now, what do we want to have a look into the now about the vein? What is going to happen is you have a superficial temporal vein which comes from above and it joins the maxillary vein to form something called as retromandibular vein. So these are the structures which are inside the parotid, and this retromandibular vein further divides into anterior division and a posterior division. So anterior division joins with the facial vein. Posterior division joins with the posterior auricular vein, and the anterior division forms common facial vein and posterior division forms the external jugular vein. So these are the venous structure within the parotid, and finally you have the branches of the 5 terminal branches of facial nerve. So it will be originating from the structure within the gland. So you have the 5 terminal branches of the facial nerve also arising from the gland. Okay, so these are the major contents within the gland. And one important thing you have to know is, if this is a top view, this is how the top view of gland is. You have the duct going anteriorly, and you have the nerve which enters like this and it comes out superficially like this, and you have the vessels and all, which is very deep in this region. Okay, so this is how the gland will look from above. So that from the deep part your facial nerve enters, and from it exits more superficially. Okay. Now let's talk about the nerve supply. So what is important about the nerve supply? So what is the function of your salivary glands? Salivary glands function is to release saliva or secrete saliva. So let's start from here. There are certain fibers which come to this to stimulate the submandibular and sublingual salivary ejection. So these fibers are known by the name secretomotor fibers, or we can call it as parasympathetic fibers. So secretomotor fibers, by name itself, it means it is going to it is going to give the motor supply, and it is going to give a secretomotor supply, by the supply by which the secretions are made possible. Okay. So secretomotor fibers, then sensory, and then vasomotor sympathetic fibers. These are the main nerve supply of your submandibular gland. So submandibular gland is supplied by the submandibular ganglion. Now what is ganglion? Ganglion is a structure related to the nerve transmission. It is situated very close to submandibular gland, hence it's known by the name submandibular ganglion. And the fibers are coming and it is going to end in submandibular ganglion, and from ganglion new fibers go into the submandibular gland. So let's see from where it is going to start. So firstly, it all begins from a place called a superior salivary nucleus. So from superior salivary nucleus, the fibers are carried through the facial nerve. So the fibers are carried through the facial nerve, and it is first through the sensory route of facial, and then you have a ganglion. Ganglion is going to come here. It is known by the name geniculate ganglion, and from geniculate ganglion, it enters the facial nerve proper. So this is the facial nerve proper. This much area is the facial nerve proper. And from there, a small branch by name chorda tympani. I am tracing the branch chorda tympani. This is the way it is going to come out, and it is going to come here and supply. So the chorda tympani basically is involved in two things. One is it is going to carry the secretomotor fibers. Second is it is going to be involved in taste sensation. Okay. So secretomotor fibers start from superior salivary nucleus, then it goes through the sensory route of facial nerve, then geniculate ganglion, then facial nerve proper, and chorda tympani up to the submandibular ganglion. Okay. And sensory supply is lingual. Vasomotor sympathetic is a plexus on the facial artery. Okay. Let's see the questions. Sublingual salivary gland lies. Anyone? So, yeah. Among the options, yes, it is superior to mylohyoid. Okay. It is not below mylohyoid, or it is not deep to genioglossus or geniohyoid. Deep part of submandibular gland is in relation to what? Which nerve? Deep part. Okay. Superficial part, which nerve, which artery, and which vein was related? The superficial part. Superficial part is related to which nerve? No, I'm not asking about deep part. I'm asking about the relationship of superficial part to a structure which is lateral to it. I'm making it more clear. Yes, facial artery, vein, and nerve. Mylohyoid nerve, mylohyoid muscle, everything is there, but it is in the medial aspect. Okay, I'm talking about the outer aspect, lateral aspect. Yes, facial artery, facial vein, and the two branches of facial nerve. Okay. Now here, what they have asked is deep part of submandibular salivary gland is in relationship. So deep part they are asking about. So each option, let's see. Facial nerve, it is in the superficial, it is outside. See, like this, it should come. Then lingual nerve. Lingual nerve, is it in relationship to the submandibular glands deep part? Accessory nerve. Accessory nerve, no, because it supplies sternocleidomastoid outside and the trapezius. Mandibular nerve. See here, the answer, correct answer is lingual nerve. We talked about lingual nerve, submandibular ganglion, everything is very close to it. Now, a question may arise, why not mandibular nerve? Lingual nerve is a branch of mandibular nerve. So, mandibular nerve as whole, it is not in a relationship with the deep part. Only the specific branch, lingual nerve, is in relationship. So, that's why the answer is lingual nerve. Okay. Always the best answer should be, you should choose the best answer among the options. Which of the following is not present on the medial surface of submandibular gland? Medial surface. Yes, very good, very good. So just see how simple the questions are now. When you know the picture, the questions are very simple. Nerve supplying submandibular gland. What is fifth cranial nerve? Okay. What is ninth cranial nerve? Glossopharyngeal. Very good. What is seventh cranial nerve? Facial, isn't it? What is 12th cranial nerve? Yeah. So which one will be the answer here? Nerve supplying, they have asked. Okay. So when such question comes, you assume they are talking about the what is the function of this gland. I told the function of gland is to secrete saliva. So when they ask about nerve supplying submandibular gland, always think that they are asking about the nerve which is going to cause the function, or which is going to help in functioning of the gland. So that is your facial nerve. Okay. Trigeminal nerve also supplies the submandibular gland. The lingual nerve is a part of trigeminal nerve itself, but it gives only sensory supply. Which of the following muscle divides the submandibular gland into superficial and deep part? Tough question, isn't it? Yeah, Malahide. Very good. Which of the following nerves may be injured during excision of submandibular salivary glands? Now, this is a clinical point of view, or this is a question which you may feel that it is from the surgery side. But actually, they are just asking you about which among the following nerves are not related to submandibular salivary gland. So, any nerve which is close to the submandibular salivary gland may get injured while the gland is being removed. So, all of these may be injured during excision of submandibular gland, exception they have asked. So just tell me the odd one out. Which among the following is not really related to submandibular salivary gland? Which is not related? Yes, spinal accessory nerve. Why? I told it is to the neck and the muscles of back of neck and the sternocleidomastoid. That is spinal accessory nerve is going to supply. So parotid. Now come to the supply of parotid. So now what did we say when we talked about the submandibular gland? About submandibular gland, we said that the nerve supply is from superior salivary nucleus. Now what is happening here? Here it starts from the inferior salivary nucleus. So the preganglionic fiber originates from the inferior salivary nucleus, then it goes through the glossopharyngeal nerve, tympanic branch, tympanic plexus, and lesser petrosal nerve, and relay in otic ganglion. The postganglionic fibers reach fibers through the auriculotemporal nerve reach the gland. So let's start again. Yeah, it originates the preganglionic fibers originates from the inferior salivary nucleus, and then it passes through glossopharyngeal nerve, the tympanic branch, the tympanic branch, the tympanic plexus, and then the lesser petrosal nerve, and it relates in the otic ganglia. Okay, so the difference here is the superior salivary nucleus is involved in submandibular gland. So you remember superior S and submandibular gland S. So parotid, it is inferior salivary nucleus. Okay, the originates from inferior salivary nucleus. Okay, so understand the difference between both. Sympathetic vasomotor. Sympathetic is a vasomotor from the plexus around the external carotid artery. Sensory nerve to the gland is auriculotemporal, and parotid fascia, it is greater auricular nerve, that is C2. Now about the duct. Now parotid duct, it runs anterior to the masseter. It runs anterior to the masseter, and what it does is it runs anteriorly, and from the front of masseter, it turns inwards, and it is going to pierce buccal pad of fat, buccopharyngeal fascia, and buccinator muscle. Then it opens in the mucosa. So this is regarding parotid duct, and when there is a accessory parotid gland, it usually occurs somewhere in the region of the duct. Small surgical excision of a parotid gland endangers all of the following except parotid gland. Just see which all structures are within the parotid or near to the parotid, and which one is not near. That will be the answer. That will be the answer. Can't see the chat window. It's okay. Okay, you have answered as hypoglossal. Very good. So hypoglossal is related to tongue. It is nowhere near to the parotid gland. The secretomotor supply of parotid gland is through which ganglion? Which ganglion is it? Otic ganglion. Okay. Your geniculate and submandibular ganglion is involved in submandibular secretomotor supply. Okay. Again, secretomotor supply of parotid comes from auriculotemporal nerve, because that is the postganglionic nerve. Which of the following is not found in parotid gland? External carotid artery, facial nerve, auriculotemporal, buccal branch of mandibular nerve. Which one is the answer? Yes, it is buccal branch of mandibular nerve. Now, which is this buccal branch of mandibular nerve? Have you come across this nerve anytime? It is the same nerve which is inside the oral cavity. Buccal block you give to extract the posterior teeth. So you are trying to block this particular branch. Yes, long buccals. Okay. So this is not found in parotid. Okay, this is not found in parotid. This is not related to parotid at all. But buccal branch of facial nerve is related to parotid gland. Parotid duct traverses which muscle? I said it pierces three structures. One is buccal pad of fat, buccopharyngeal fascia, and which muscle? What about option A? Are you asking regarding parotid duct? Are you asking regarding parotid duct, Sujay? Yes, buccinator is the answer. Somebody has asked about question 4. Okay, one second. I'll just see. ECA is external carotid artery. ECA is external carotid artery. It is found inside the parotid gland. External carotid artery divides into posterior